Okay, you're welcome. Welcome, everyone. Kindly confirm that you can hear me. Hello. Hello. Who is home? Can you hear me? Do let me know if you can hear me. Welcome back. Welcome. If you are just joining us, welcome. Kindly drop in the box if you can hear me. Okay, let me know if you can hear me. Okay, Raniji Rajan. Thank you. Thank you. Thank you for the feedback. Hello, Rajan. Thank you so much. So you can hear me clearly. Yeah, I want to be sure that my audio is clear, and then I hope the video is also good. Kindly confirm that my video is okay too. Okay, thank you. Thank you. Thank you for joining in my live. I had a break earlier. We had a very powerful session earlier, and then it was quite engaging, quite informative. And then we are actually going to continue the part 2 of this important topic. I'm sure if you check the thumbnail and the description, I put there the topic for discussion. Thank you, Rajan. Thank you so much. Are you in India? I'm presently in Nigeria. I'm I'm a Nigerian speaking live from Lagos, Nigeria. I'm a medical doctor. So I appreciate you're joining in. Oh, you love Nigeria. Okay. Rajan is on the moon. He's on the moon tap dancing. Wow. Okay. Keza, do you know Rajan? Keza 69. Okay, you love Nigeria. That's good. So what do you know about Nigeria? Okay. Dark-sided. I may have to remove you. Inappropriate comments there. Okay. All right. Thank you for joining. Remember to tap on your screen. Double tap on your screen. Kindly double tap on your screen. The other time we had about 1,000, okay, close to 1,000 people, about 800 or 900 people joined. No, I saw about 1,000 earlier joining the earlier live session that we had, and that's really a great one. And then I observed that a number of people subscribed. I want to appreciate you if you subscribed earlier and you're just joining in. Now we are going to be having the part 2, follow up on our discussion earlier. For those that were part of it earlier, we're going to part 2. For those that are just joining in for the first time, I am Dr. Soyemi. I am a family physician, medical doctor. I practice presently in Nigeria. And interestingly, I offer online consultations. So I have patients in different parts of Nigeria and outside Nigeria. So I'm passionate about people's health. I'm passionate about educating the world on achieving better health and developing better and more healthy habits for life, to live healthy, talking about diet, talking about exercising, talking about preventive medicine. I'm also committed to helping people who are already being managed for certain medical. Okay, I think someone was trying to reach me, so there was a network interference. Let me know if you can hear me now. Stop crying. Come and do it. Let me know if you can hear me now. Rajan, I'm trying to add you as standard moderator. Thank you for your comments. If you have the blue jacket, you should be helping to serve as moderator on this live. As much as possible, we want healthy communication, healthy comments. So, okay, Jericho 10,000, you are welcome. I can see you. Thank you for joining in. Remember, you can subscribe to this health channel, talk about health, wellness, and lifestyle. And this is one thing I'm passionate about. Rajan, okay, you say we should block the people that are interfering with unhealthy comments. So you can help us. I thought I made you a moderator. Yes, you're a moderator, Rajan, so you can help us. Thank you. Welcome, everyone. If you are joining in for the first time, or even if you are rejoining, kindly drop your location. Where are you joining in from? Let's know where you are joining in from. Okay, I know people are in America. I have a number of subscribers in the United States, aside Nigeria. There are others from India, Kenya, Uganda, and then different parts of the world. So let me know where you are joining in from. Let's know where you are joining us from. Welcome, Jericho. Keza, welcome. Caribbees Shots, Keza 69, Ian, K-Cell, K-Cell. Okay, sorry you're coming in late. Just got notification here in the ears. Yes, I kept shouting K-Cell earlier when we had the first session of this YouTube live. It was an interesting session. You can watch the video. I've made it public. You can watch it later. We actually talked about cancer as requested. We did a part one of the discussion on cancer. Talking about cancer, gave some statistics and some background, talking about risk factors and causes of cancer. Hey, Cook with Sandy is here. Hello. You're welcome. Thank you for joining in. Wonderful people. KCL is saying hello to you, Sandy. Ifeoluwa, okay. Oh, is it okay? You I believe you are Nigerian. You're welcome. Rewrite. Ifeoluwa. Okay, Kesel, you got me there. Good morning, Ifeoluwa. Okay. Is it okay or okay? Yeah, Sandy is asking Kesel, how are you? Okay, yes, Ifeoluwa joining in from Nigeria. What part of Nigeria? Let's know in the chat box. I appreciate this great community. I see that we are growing bigger. I mentioned earlier that this is my third year being on YouTube uploading videos. One day I'm going to be sharing my experience. Maybe I have some notes already. Maybe by the time we hit the 1,000 subscriber count. As I mentioned earlier, a number of people subscribed at the earlier session we had today. We moved from about 800 to 900 and just less than 100 to hit the 1,000 subscriber count. Okay, so if you are yet to subscribe, kindly click on the subscribe button. Kindly encourage me. Okay, okay, maybe some more encouragement. Okay, for the past 3 years, I've had to encourage myself. The passion has been there, and I remain committed to educating not just my patients when I see them one on one, when I have interactions or at consultations, at speaking engagements, public speaking, physical meetings, online meetings that I'm engaged in, but on the social media platform, YouTube, Facebook, and other platforms. I remain committed to providing you with valuable, up-to-date information, and sometimes they're actually basic information that you can relate with, that you can personalize, that you can. These are some of the things that your physician would normally need time to communicate with you about. Talking about counseling, talking about appropriate and adequate information. Sometimes if you are like me, you have observed that there's a whole lot of information out there, using different platforms, search engines, Google, talking about Edge, different social media platforms, even on YouTube, Facebook, Instagram, Twitter. You can get information everywhere now. But most of this information are actually general, except where you have professionals like me setting up platforms like this to have specific and then facts presented to people. Okay, so it is important for us to note this. KCL says, I'm doing well, Sandy. You get a good dress. Sandy live from Abuja, Nigeria. Yeah, Sandy, well done. Sandy is also a YouTuber. KSL is a YouTuber. Quite a number of people joining in are content creators. I'm sure you can connect with them at the end of this session. You can check their channels, interesting content. And I need to mention that for every one of us, there are different aspects of our lives. For you as an individual, you must understand the fact that you are not just about the physical, it's not just about your body. Interestingly, sometimes, or even most times, people experience things in their body that actually come from their mind or even their spirit or their environment. So you as an individual, you are not just, it's not just you. There are different factors that determine who you are, that affect your health. Talking about your environment, your social environment, your relationships, talking about the kind of relationships that you keep or you have. Do you have positive relationships? Do you have people that are like-minded, that are going in the same direction that you are going? These are things that actually affect your mental health and in fact your overall health. Also, the way you train your mind, the more you get informed information, appropriate information, the more you read, the more you study, the more you listen to others. I must tell you that I listen to different people. I connect with different people. I love information. Okay, you say maybe because I'm a medical doctor. Possibly, I just love reading. I love studying. I love learning new things. So I know we have different categories of people here. People in music, people in health, people in education, people in technology, people in engineering, have different cadres, different levels, different specialties, different professionals. So, but one thing is common to us: health, health. And as the World Health Organization defines health, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I hope you got that. Health is not just about disease or infirmity. It's a complete state of complete physical, mental, and social well-being, even spiritual, and not merely the absence of disease or infirmity. So you are as healthy as your mind is, you are as healthy as your environment and relationships are, you are as healthy as your spiritual state is. So you must learn to watch on these different sites, you must learn to monitor those different areas of your health as an individual. So you must learn to develop, grow, maintain quality relationships, positive relationships, relationships that are productive, where you are learning and you have a vision, mission, even together that you can make things happen. Hey, please, I can only see 5 likes. Kindly double tap on your screen. Kindly double tap on your screen. You get to show that you like this session. Yes, KCL. Okay, KCL responding to. Thank you. We have 6 likes now. More. We can have more. Thank you. I must say again, I'm so grateful for those that subscribed earlier. We actually moved from about 800 to 900, and maybe in this session we're going to be hitting the 1,000 subscriber count, and then moving to the watch hours. Okay, that's an interesting aspect of YouTube, where what you are doing is being rewarded uh, in different ways, not just by YouTube company, but various groups, individuals, talking about collaborations, talking about people showing appreciation for what you do. Okay, so I like that you subscribe, and maybe by the end of this session, we would have come to 1,000 and more subscribers. Thank you for subscribing. Depressed Soul is asking where are you from? Okay, Yuli and Nona asking if I'm Nigerian. Yes, I'm Nigerian. Yes, KCL is saying to Sandy, the doctor will be talking about cancer that he requested. Okay, he said he's late because of notification. Don't worry, KCL. I'll quickly do a summary of what we discussed earlier and then go into the part 2 of what we are doing. Olalekan Ayoda, you're welcome to this YouTube live. Thank you for joining in. Let's know where you are joining from. Adam Charge, England. Hello from England. Thank you for joining in. Adam, Repent Remnant said you received a mail from Nigerian Prince. You wanted your bank information to transfer some money through. Should you respond back? Okay. I don't know. You need to find out. Go to appropriate quarters to do the appropriate in terms of identifying who that person is, and then be sure it's something right. Okay, KCL, you said you got me, doctor. Tulika Key back. Hello, thank you for joining in. Hey, the panda, you said you broke your fingers 2 days ago. So sorry about that. Hope you are getting some uh, treatment for that. Hope you heal fast. Hope you get speedy recovery. Sorry about that. Cook with Sandy says you are doing well, sir. Thank you so much for the valuable health tips. We appreciate, Doc. Thank you, Sandy. Thank you for being there. Thank you for your support. Thank you for the community growing together. I got my degree in Nigeria, from Nigeria, all Nigerian universities. KCL, to all new just joining, welcome to Dr. Soyemi. If you are liking the content, please hit the like button. It will be greatly appreciated. Thank you. Yes, KCL, thank you so much. Thank you. Thank you. KCL saying, Doctor, we are very much the same in many aspects. Ow, you need to tell me more, KCL. You need to tell me more, okay? More. I need to know more of that. More about that. Ude Setia, you're welcome. Alicia Benefield Williams, I can see your comment. Hello, good morning from Alabama, United States of America. So how is it going? Preparation for the elections, upcoming elections. Well done. I wish you all the best at the elections. Kiara Toft. Hello, you're welcome. Okay, thank you, KSL. Yes. Alicia is appreciating you, KSL. Thank you. Okay, everyone, welcome once again. Please double tap. Please confirm that you can hear me. I know there are some background noise though, but confirm that you can hear me clearly. I can see someone joining here. MK's Arena. Good morning. Thanks for joining in. You're welcome. Welcome. All right. So, different people from different parts of the world joining in. Okay, so I'll just give a brief on what we had earlier. This is part 2 of the talk on cancer, as specifically requested by KSL and a few other people that were on the live we had some days ago. Was it yesterday or 2 days? Okay, so but I heard that people should drop their questions, and we had a number of questions. Presently, trying to be sure to pick from these different questions and start to talk about them as a topic. So that means we have people's interest being considered when it comes to health topics. Greece from the age. Okay, thank you, MK's Arena. Thank you. How are the patients? How's work? Thank you so much. Okay, we are looking for more likes. Kindly like this session. Okay, from Texas, Grace for the H. I can see your comment. Thank you. Good morning. How is Texas this morning? Alessia, he said it's definitely scary. We can't have Kamala and the president seat isn't for a woman, period. Okay, this is politics here now. Okay. Okay, you are bearing your own mind about the elections, and there must definitely be freedom of speech, freedom of expression, and then freedom of association. Okay, so you have a right on who you are voting for, and of course, as much as possible, we still keep our relationships right as we go on with this. All right, so MK Arena said the patients are fine. Okay, thank you. I hope someone can. Do you still have the pinned message or pinned comment? Someone can type in this part two of the talk on cancer. Okay, kindly confirm that you can hear me. You can still hear me clearly. Kindly confirm. Kindly confirm. Kindly confirm. Kindly confirm. Trying to adjust my video to be sure that you are all okay with this. Okay, you have 9 likes now. Can you hear you well? Okay, is this a question or a comment that you can hear me well? I want to know if you can hear me. Just let me know. You can type in audio is clear or very clear. Is it that you can? Okay, you can hear me. Thank you. Grace for the H. I appreciate your feedback. Okay, thank you so much. Thank you. Thank you. Thank you. Thank you. Thank you. Okay, so the audio is very clear. Thank you so much. Thank you. Thank you. Okay, so in summary, thank you for the feedback. From our last session, we had an introduction to the talk on cancer. I gave some statistics. Interestingly, it's been said that 1 in 3 persons are likely to be diagnosed of a cancer. That's startling. That's startling statistics, and we all know that this is a this of global concern, and it's a topic that requires frequent discussions as research keeps ongoing, new methods of treatment, innovations, and then different supports that people that have been diagnosed of a cancer are receiving. So we talked about the fact that there's no barrier to those who gets the diagnosis of cancer. Diagnosis is made all over the world in different places. Different types of cancers are diagnosed every day, and the cancers may differ in terms of the type in different locations. There's no race barrier. There's no barrier of race. There's no barrier of language. There's no barrier of age. The young get to receive that diagnosis. We have some middle age, and then older people commonly may have diagnosis of a cancer. And then we also have no barrier of gender. Females, male gets to have this diagnosis, and then all over the world, people are concerned, and the cry is, can we have a lasting solution? Can we have a cure? Is it true they have a cure for cancer? But big pharma won't let us know. Okay. Yeah, so I'm still doing my research on this aspect. I know there are a whole lot of concern about there's a cure, people want to sell, and they are still producing drugs. They just want people to keep consuming drugs to probably enrich their own pockets. Okay, so there's a lot of discussion on that. Candy Henry, welcome. Good morning. So, apart from the fact that there's no predilection in terms of on the general note, but certain cancers are common in certain people. Whether you talk about skin cancers, or you talk about breast cancer, you talk about breast cancer commonly in female, talk about prostate cancer in male, definitely. And then lung cancer in areas or regions where people smoke a lot, or industrialized regions where there's a lot of generation of toxic substances, where people get to inhale these substances which are toxic to the body. Okay, so it's important that you know that, as I mentioned earlier, a lot of research is ongoing, different innovations, different uh, drug, new drug releases, vaccines, trying to help in the cure or in the treatment of cancer. So, and as a matter of introduction, we said that cancer is abnormal growth of cells in terms of multiplication of cells, and then in terms of the size of the cells. So that is why sometimes you actually notice that for some type of cancers, usually a lump, a growth, that's an increase in the size of a particular part of the body of the individual that's been affected. So there are complex different complexities when it comes to cancer, the risk associated with developing a cancer, the symptoms, the diagnosis, and then treatment. Yeah, okay, so you say here in the United States, in the States, food in the store are very processed, using unnatural ingredients that are still being linked to cancer. Yes, we talked about that too earlier, talking about the causes of cancer. I mentioned that first of all, there's a genetic factor to developing a cancer, and people who have probably had a relative, maybe generations long before, that have had a cancer, there's a possibility of developing a cancer in subsequent generations, even though this is not always true. It's not always true. Okay. Kessel, you lost your uncle last year and your older sister the year before by cancer. Wow. Okay, so you can see how important this discussion is. I've had close relatives that have also died from cancer. So this is something that um, affects people globally, and then we need to look at ways at which we can educate ourselves to prevent the increase in this. Okay, and it is not just about this education. It's not just about information. It's about taking action, about taking steps to ensure that we prevent this development of this disease. So, a number of people have one person or the other that has had a diagnosis of cancer before, and you can imagine how emotionally draining that could be. The impact on the not just the physical health, the mental health, and even the social life of the individual that's been diagnosed of a cancer. Now, there are people that have definitely lost their jobs because they needed to go through treatments for a cancer. So, a lot of things are lost when this diagnosis is made. Unlike some conditions, maybe you've had a stressful day and you're feeling a headache or a body pain, you can decide to take analgesic and then get some relief and rest. But a person with cancer has to go through a lot of investigations, a lot of different medications depending on the type, and then follow up. So you can see how really demanding the toll that this can take on an individual, not just the individual, but people that are connected, talking about friends, talking about relatives, because such people need support from friends, from families at such a time. And then this cancer uh, is not even limited by politics in terms of whether someone belongs to this party or the other party, and it does not have any limits when it comes to which category of persons that it affects. Person could be poor when you talk about wealth or money. Person could be a rich person that's experiencing this cancer. So, having talked about that, we are talking about the risk factors now. I mentioned that genetic factor is a major factor because cells, genes are passed from one generation to the other, and if the gene that is responsible for a particular cancer is passed from one generation to the other, then that next generation can develop it. Okay. Okay, so Kesel, sorry about your experience losing an uncle and an older sister to cancer. Okay, so while we are doing this, thank you for requesting. Okay, we are doing this to help ourselves to put in measures to prevent this. Okay, so that you are relatives that have had this experience doesn't mean that you will have that kind of experience. Okay, it is well. Ave or say, I don't know what you are asking. Thank you, Kesel. Yes, please note that you do not come on this channel with rude comments. You will be removed from this channel. Thank you for that. Thank you. Thank you so much. We're talking about maintaining good health and achieving better health. And that also includes our mental health. So, what we see, what we hear, what we say, what we think about are things that affect our mental health. So, as much as possible, we want a sane community. We want comments that are productive, that are engaging, that can add value to others. Thank you for noting this. Okay, Greta. Okay, you're welcome, KCL. Thank you. Greta, you're from Germany. Hello, Greta. You're welcome. Welcome. Okay, so still talking about risk factors for developing a cancer. So apart from the genetics, the individual's diet, life pattern can also be risk factors for developing a cancer. As mentioned, someone dropped in the comments, processed foods, a lot of junks, a lot of fast foods are actually risk factors for developing a cancer, and it is advised that you limit your consumption of such foods. So, also other factors we include people with some chronic medical disorders, like people with, for example, I mentioned something about diabetes, okay, whereby the immunity of the individual is maybe low, and then such person is at risk of developing a cancer. Also, people who have hepatitis, for example, a viral hepatitis like hepatitis B, such an individual has this virus in their system, and then the effect on the liver, which may be complicated with a liver cancer. Okay, so that's a possibility. So there are different medical conditions that can cause a person to develop to get a cancer. Okay, Anastasia Umro. Okay, I love Hausa. I love Hausa language, but I'm not Hausa. Do I look like one? Do I look like one? I'm actually Yoruba. Yoruba from Nigeria and Lagos presently. Okay, so still talking about risk factors. We talked about chronic medical disorders, some medical conditions. Others include exposure to radiation. Some people get to develop skin cancer from overexposure to ultraviolet radiation. Even people who work in radiology centers, people who handle patients with for radiological investigations, they're at risk of developing a cancer. So that's why protections are used. Lead protection usually used by those who are operating such equipment. All right. So apart from that, generally, there are some skin conditions that put people at risk of developing a skin cancer. So we will talk about prevention towards the end of this session. Okay, so other causes include stress. Individuals who are overwhelmed by stress, any factor that will cause a disturbance in your physiology or your normal state that will reduce your performance, any factor. It could be a relationship factor. It could be a work-related factor. It could be relationship, as I mentioned, a relationship factor. Any factor. It could even be a political factor or social factor. Talking about different issues in different nations, protests ongoing. So people are stressed. People are tensed. So any of this can affect an individual's mental state. People are depressed, people get to be anxious, and this puts them at risk of having a reduced immunity, and their defenses are actually reduced. They're not able to fight against infections. They are now at risk of developing a cancer. So, having a strong uh, mental health, healthy state is very crucial to uh, preventing developing a heart attack. Okay, so other if you have additions, kindly drop in the comment box. Kindly drop in the comment box. Yes, in the chat box. Yes, kindly drop in the chat box. I just it's now becoming more than a summary, but for those that are just joining in, we're talking about cancer, and this is the part two of the discussion on cancer. This is a global, it's of global concern. Okay, Louise, you're welcome. KCL says, welcome. Thank you all for joining. If you are liking Dr. Soyemi's content, please hit the like button on the topic cancer. Yes, that's the topic. We are hitting the 1K subscriber count today. I think so. I think we are hitting it today. We are above 900, and I believe that a number of people, thousands of people joining from different parts of the world would find this channel helpful, useful, and interesting. I am committed to bringing you more content, more educational, more helpful health content to help us live better lives. Louisa, you're welcome. Okay, yes, fatty liver. Yes, Sierra Ridgeway. Yeah, these are areas that we will definitely be talking about. A lot of people are now coming up with fatty liver. Yes, people can develop liver cirrhosis. People can, I mentioned earlier, liver cancer from viral hepatitis. High levels of fat, cholesterol in the body can make an individual to have such deposits as the liver produces fat and also receive deposits from external, from consumption. Then an individual with such can have a fatty liver, and there are different stages. Okay, we'll talk about that in some other sessions. Okay, doctor, I think that's why my health has been so good. One was good than bad. Why? I didn't get that. KSL, you're saying that your health has been so good. Why? What exactly? Okay, Louisa is excited. I'm also excited. Yes, 1K all the way. Yes, all the way. Yes, we are eating that. Okay. Yes, Cookie Sandy is saying hello to you, Louisa. Yes, Lisa is asking how you are today. Kindly double tap on your screen to like this YouTube live and click on the notification bell. Remember to subscribe so that you can receive regular notifications when I come up live and when I am uploading videos. Thank you. Thank you. Okay, so still talking about risk factors. I was talking about immunity, low immunity. Okay, other factors. Uh, if you have any that I have not mentioned, you can drop them in the chat box. There are a whole lot of factors that could make an individual be at risk of developing a cancer. Okay, I'm noting your question. Foreign protein be a cause in man's disease. Okay, I'll note your question. I need to clarify that. Now, thank you, Kesel, for your question. The other aspect that we talked about has to do with the symptoms. Yeah, symptoms. We started with the symptoms and we had to take a break um, after mentioning one or two symptoms of a cancer. As mentioned earlier, there are different types of cancers depending on the part of the body that is being affected and also depending on the type of cells, because in confirmation of a cancer usually histology is done, view of the cells under the microscope to confirm what type of cells these are really, and there are different types even for the same cancer. So it is important to know that there are a number of symptoms that an individual with a cancer can have. And I started by mentioning unintentional weight loss, which is a common one. And this can come earlier in some individuals, it can come later in the course of the disease in some other individuals. Okay, these individuals did not do not actually plan to lose weight. So having a weight loss of about 10 kilograms within a month uh, could be a pointer to an individual with a cancer. And another point is this: I mentioned cough, chronic cough, which can be directly related to an individual with a lung cancer, cancer of the lungs, or an individual with another type of cancer affecting another part of the body, yet that cancer has metastasized, that is spread from that particular region. For example, a breast cancer patient could have metastasis, that's a spread of that cancer to the lungs. And when that happens, such an individual may manifest with a cough. So when there's a chronic cough, as I mentioned earlier in this the YouTube live session we had earlier, chronic cough is not the only cancer is not the only manifestation that we get that a person gets from chronic cough, but such conditions like even a lower respiratory tract infection, an individual with tuberculosis could have a chronic cough and it may be productive of sputum. So it is important to note and present to your doctor if you know anyone around you who is manifesting with a weight loss, unintentional weight loss, manifesting with a cough that is persistent, and these are pointers to someone that will require evaluation by a medical practitioner. Okay, I hope you are still following. Let me know if you are here. Drop in the chat box what you are learning from this. Okay, next let's talk about the growth itself, as mentioned earlier, it could be multiplication of cells, actually, abnormal cells in the body, and in terms of the size of that particular part of the body being affected, it could be a manifestation with a growth, and that growth usually may be seen in people who have external manifestations like a growth on the skin and different parts of the body, or it may even be in the breast, as in breast cancer. So, such individuals with cancer may have a growth, may even start initially as a small size uh, swelling, which may now increase in size. The increase in size may happen within a short period. It may even happen within a long period. So abnormal growth could is actually one of the symptoms of a cancer. Fever could also be a symptom of a cancer. An individual with a cancer of the blood, for example, can manifest with fever, and some other conditions, types of cancers can manifest with fever, and the fever could also be high grade. Okay, your internet is lagging behind. Okay, lagging a bit. You are still here. Okay, thank you, Kesel. Thank you. If you are just joining in, let's know where you are joining in from. Remember to click on the subscription button. Remember to double tap on your screen. All right. So, still talking about symptoms. Fever. I've mentioned fever. Malaise, loss. That feeling of unwellness actually is malaise. So, an individual with a cancer may just be complaining of feeling unwell. So it's important to note these symptoms so as to help to identify people and help them to get to be seen by a medical doctor for proper assessment so that this cancer can be detected early for early diagnosis and then prompt management. Okay, so I mentioned Malay. Others include nausea, that is, nausea may even be vomiting. Individual may vomit, especially with gastrointestinal cancers, colorectal cancer. In fact, the individual may also be passing dark stool called melena, dark stool. Some individuals may even find blood, may have blood stained stool. Okay, I'm not saying that in every situation that this happens means a cancer. No, some people even have hemorrhoids, and this can also be a cause of blood in stool. But a number of people with for example, gastric cancer may manifest with weight loss, may manifest with um, loss of appetite, may manifest with nausea, vomiting, while an individual with a colorectal cancer may manifest with dark colors too, may manifest with blood in stool or blood stains too. Okay, so these are some of the other symptoms of cancer. So others include pain, could pain in that particular part of the body or other parts of the body from metastasis. People may have bone pains, especially people with prostate cancer, even with breast cancer. There could be metastasis, that it is a spread of the cancer to different parts of the body, especially the bones. Let me know if you are still following. Let me know if you are still here. Kindly drop a comment in the chat box. Hey, who is there? Who is there? Can you still hear me? Let me know if you can still hear me. Okay, so Okay, so I can see your message. You say your sister passed away in less than 6 months after finding out she had cancer. Yes, there are some cancers that do not actually give that kind of time, and one of it is pancreatic cancer. Manifestation symptoms may not come up early, and the individual could have actually entered into some complications before the detection, and that usually may lead to early mortality, as the death of the individual. Okay, so that can happen, and that's why screening is very important. I will be talking about prevention. So, if there are other symptoms of cancer that you can find, that you can drop in the chat box. So as I mentioned, the individual may also have loss of appetite, as anorexia. Individual may be vomiting. I mentioned that earlier. Okay, there are other symptoms. I mentioned pain. Yes, pain is a common one, especially when it has entered into some more complicated cases. Yes, that could happen. So if there are other symptoms of cancer that kindly mention in the chat box. Individuals with such could also have reduction in their blood. Now, cancer has a way of like sucking, like drinking blood, something like that. Okay, so people with cancer, that's why sometimes you find out that when they check their blood levels, usually is low because the cells are eating deep into the body, into the blood, and then the risk of this development of anemia. So such individuals are also at risk of developing other infections. Other infections. Okay, talking about causes, I mentioned earlier that there are some diseases, there are some infections or in the some conditions that predispose an individual to developing a cancer. For example, the cervical cancer now. People with HP virus, human papilloma virus, are at risk of developing a cervical cancer. So that's why screening should actually take place early enough, and people that can benefit from vaccination should do so. Welcome, Franca. Franca Raphael, thank you for joining in. Thank you for joining in. Okay, there's a whole lot of prophecy about war. Okay, but Israel, that's the name you are using on this live. We would not entertain such comments. We still have to talk about health, even as the world is experiencing so many changes. Aaron J, since you were part of this live earlier, just confirm. I saw you joining us earlier. I think you're part of the initial the session we had earlier. We kindly confirm. Thank you for joining in once again, Aaron. How is Austin, Texas today? What time is it in Texas? What time is it in Texas? Kindly confirm. Okay, so we have to move now to what are the relevant, I'll go to relevant steps to be taken in early detection of a cancer, and then the treatments available, and finally we talk about prevention of cancer. So what are the steps? It's important, as I mentioned, that this is a global matter, it's a global issue, and it's of global concern. There's commitment from governments, commitment from individuals to fund, to support, and see that cancer is being addressed and dealt with. Researches are ongoing to help with new ways, methods of treating cancers. Aaron J, it's 5:20 a.m. in Texas. Thank you. Thank you for the feedback. Thank you. Okay, 6:20 in Virginia. Is it Virginia? Thank you. Yes, Virginia. Thank you. Thank you. Yeah, if you are just joining in, we are talking about cancer. Why cancer? So we've talked a lot about the causes of cancer, the types of cancer, and then we've talked about the symptoms of cancer. We're now looking at the steps, the approach to management of cancer. Okay, since this is a medical condition, a disease situation condition, this requires proper evaluation by a certified health care provider, medical doctor, and this step actually involves presenting to your doctor, or if you know anyone that has these symptoms that I've mentioned, uh, individual needs to present to their doctor to actually make this complaint. It may be a cancer, it may not be a cancer. So it's important to present to the hospital to get the correct diagnosis. Okay, self care, self medication, that's the word, should not be encouraged in such situations. Okay, so the individual needs to present to the doctor, where the doctor will take detailed history, and that history will definitely begin with your name, where you live, where you have lived, a whole lot of information, your age, whether you're married or not, and then go through the complaints that you have, and exploring the symptom and to other symptoms that may be related, in trying to identify the particular cause of the symptom or symptoms, and to make a diagnosis. Definitely, a detailed examination will be carried out, general examination, and specific systemic examinations. For example, people who have a complaint of a lump in their breast will not just require examination of the lump or the breast, it will require a general examination. First of all, the weights of the individual will need to be taken, and that's to help to identify and confirm with fact that the individual has actually lost some weight, and it will also help in dosing of medications. So also past medical history. Of course, before that, the treatment that the individual has received will also be noted. Now, past medical history will include if this individual has been admitted before, because some individuals are actually coming in with a recurrence of a cancer. And if individuals have had treatment before, similar treatments, that may mean that there is a recurrence in the cancer or some other disease condition is being manifest or developing. So it is important to have this detailed examination of the general system, and then specific examination. Detailed examination will also reveal if the individual is low on blood, may be anemic clinically. Individual may have some lymph nodes which are swellings in some parts of the body, like the armpits, the neck, and these lymph nodes are also signs of a way of identifying a possibility of metastasis, that is a spread of these the abnormal cells, cancer cells. So it is important to have this detailed examination, and then necessary investigations will be requested by your doctor when doctor is coming to a point of making a diagnosis. Differentials will be stated. The differentials may include that a breast lump, for example, that a woman has a lump in their breast does not automatically mean that that's a breast cancer. It may be a breast cancer. It may also be a benign growth. For example, it could be a mastitis, just an inflammation of the breast. It could be a fibroadenoma, which is a benign, that is not a deadly type of growth in the breast. Okay, so that's where taking a sample, that is taking a sample, maybe an excisional biopsy of that particular growth is important. So that will help to confirm if this is a benign growth or a cancerous growth. So other investigations may include radiological investigations, like being asked to have a scan. It could be a breast scan, a mammography. It could be a, a a CT scan, a computed tomography of the chest, for example, as required for people who may have symptoms like cough. Okay, so there are other investigations like a complete blood count to know the level of the white blood cells, to know the level of the red blood cells, and these are helpful in determining the type of treatment or how soon the individual requires treatment. So there are many other investigations that may be required by your doctor for you to have this proper evaluation. Okay, so apart from these investigations, it is important to note that a confirmation of a cancer is usually made with a histology or a cytology. That's where the sample of cell or the growth is taken for examination in the laboratory, where the type of cells will be described, and this will help to, yes, people should pay attention. Yes, ladies and the men that love them should pay attention. Yes, because there has been increasing rate at which people develop breast cancer. Okay, so the awareness need to increase. People need to live more healthy lives, uh, have better habits that will help to prevent development of this uh, condition. So it is important to follow through on your doctor's request on investigations, and then follow up after the diagnosis has been made. It's important to follow up management of cancer. Usually it is multidisciplinary. It's not just about the doctor managing. It may involve your family physician, definitely. It may involve your oncologist. It may involve a general surgeon. Depending on the type, if it's a prostate cancer, it will involve a urologist. Some other, if it's a chest, lung disease, require a pulmonologist. And then if it's something that has to do with the brain, a neurologist will be required, and then the services of a neurosurgeon. So it's multidisciplinary, including the nurses. Some patients will benefit from admission and then immediate resuscitation, depending on how acute they are presenting. If the individual has been losing fluids through vomiting or passing stool, the individual will need to be admitted and then resuscitated appropriately, so that the individual can then receive definitive management. Okay, so nurses are involved, counselors, psychologists, psychiatrists. The list is endless. The services of physiotherapists. These are members of the team that help in caring for for people with cancer. Oh, Louisa, congratulations. Your brother is getting married today. Wow. Big congratulations to him and to the family. Thank you for joining in. See you later. Okay. Thank you. Thank you. Love from KSL. Love everyone. Thank you. Thank you. Thank you. Thank you, Louisa. So we'll be rounding off with the prevention, but we're still talking about management of a patient that has been diagnosed with a cancer. Such an individual actually requires a lot of support. Emotional support is important. Some people are able to handle the diagnosis well, that is, mentally and physically, they're able to respond to what is required in terms of management. While others may, first of all, be in denial. Some may get angry at themselves or others. Some may even be so worried, become anxious, become depressed, and some may even attempt to commit suicide. So this kind of people require a lot of support from us. They require a lot of okay. With Chapa, you say you love my energy. Thank you, thank you, thank you, thank you so much. So I'm talking about individuals who have been diagnosed with a cancer. They require a lot of support. I'm not just talking about financial support. They require a lot of emotional support. They require communication, regular communication, people to be around them, people to guide them even through their management of their condition. Okay, so the support is both from the side of friends and family, the community where they live, and then on the side of the professionals, the managing team, talking about involving a psychologist, involving services of home caregivers, and then others. Okay, so that's just about the initial important facts that relate to management of patients with a cancer. And then talking about the specifics in terms of how a cancer is managed. Now, if it is a growth, an abnormal growth in any part of the body, usually it is removed. So there could be surgical intervention, removal, for example, excisional biopsy for a breast lump, to perform a histology so that there can be a confirmation whether it's a benign or a malignant breast lump. Also, some people will benefit from chemotherapy, that's use of drugs through the veins, so that they can have some form of mopping up or clearance of these abnormal cells. And in trying to do this, that's why a lot of people talk about the discussion around whether chemotherapy is really beneficial or not because of the side effects, a lot of side effects. So you see people losing their hair, having alopecia. You see people feeling weak, having nausea, vomiting, and a whole lot of other side effects of chemotherapy. In as much as some people benefit and respond well to chemotherapy, there are others that even their normal cells keep getting affected. So your physician, your managing specialist, whether it's an oncologist, or a general surgeon, would help you to be able to know whether you or the individual concerned will benefit from chemotherapy. So there are some cancers that actually respond well to chemotherapy. And finally, radiotherapy, that's exposure to radiation, also helps. Some people may benefit from surge, excision of the growth. That's surgical management. They also benefit from use of drugs, chemotherapy, from oncologists, and others also benefit from the services of a radiologist using radiotherapy. So this may be done in sessions, and there are other supportive care that such individuals require. Talking about diet, nutritionists are also involved in the care of patients with a cancer, because that also helps in their recovery. So there are provisions to help people to actually eat what will help them to recover better. There are other aspects, including exercise, involving those who are professionals in helping people to get back their fitness and shape. Okay. Okay, so that's that about the management. Of course, there is the new one talking about immunotherapy. A lot of some cancers have actually been seen to respond well. Especially skin cancer, melanoma, has been shown to respond well to immunotherapy, and a whole lot of research still ongoing to help in the management of cancers. So if you have any one that I have not mentioned, you can drop in the chat box. You can drop in the chat box. So how do you prevent getting a cancer? So we'll be rounding up here on that note. How do you avoid getting the cancer? So the first thing, um, picking it up from the risk. Now, genetics. It's important to know your family history, medical history. Has there been a similar uh, condition in some members of the family, or a member of generations in the past? Is there any history of breast cancer? Is there any history of a prostate cancer? Is there any history of a blood cancer? So it is important for you to know your history, and this will help in how you um, live your life, how you uh, put up habits that will help to limit developing a cancer. So when you present to your doctor will help you to assess, to evaluate you, your risk. There will be a risk assessment, and then proper recommendations on how you can avoid developing this cancer. Another point to note in prevention of cancer is the need to eat healthy diets, to consume foods that are actually helpful, and these are vegetables, fruits. They contain a lot of vitamins and minerals. They actually contain antioxidants. They help to mop up free radicals, which have also been implicated in development of cancer. So healthy eating is very important. Not eating of nuts, granules, um, cashew nuts. These are very helpful. Apples. These are very helpful fruits in talking about living healthy diet, and prevention of cancer. So another thing is the need to avoid fast foods as much as possible. Limit your consumption of fast foods, fried foods, a lot of foods laden with oils, fries, and all this put an individual at risk. So limit your consumption of that, and also consumption of soda drinks, carbonated drinks, and even the consumption of alcohol should be avoided, because that also puts individuals at risk of developing a cancer. Another thing is to avoid smoking. You should stop smoking if you do, because long term, in the long term, individuals with history of smoking may develop a lung cancer. And as I even mentioned, people who have smokers around them, who are exposed to, we call them secondary smokers, may develop a lung cancer or other forms of cancer. Another preventive measure is to avoid sedentary lifestyle. Now, exercise is very good. Exercise helps to keep your cells active, keep your body active, and it's one way to help with circulation of blood and helps to renew your cells, and this will be helpful in preventing developing a cancer. Okay, so KZA 69, I can see you're saying, Dr. Chemo, you're saying no to chemo. Yes, let's know why you're saying no to chemo. Thank you for that. So also whole grains and lean proteins. Yes, someone was asking about proteins. Lean proteins actually help significantly to lower risk of developing a cancer. I've mentioned leafy greens. Berries are also very good. They help to handle oxidative stress. So avoiding sedentary lifestyle is also very important in this fast-paced world, age of technology. A lot of people sit at their desk for hours, having the risk of becoming overweight or developing obesity. And these are risk factors for developing a cancer. So it is important to have a healthy weight. Obesity has been linked to even breast cancer and colorectal cancer. So regular physical activity, as mentioned, doing a moderate intensity exercise for at least 150 minutes, talking about 30 minutes, brisk walking every day, 5 times in a week is actually recommended, which is good, can help you to stay fit and reduce your risk of developing a cancer. So get moving, workout. Now, I mentioned need to stop smoking. Smoking is the leading cause of cancer worldwide. If you smoke, you may need some support to uh, deal with that habits and lifestyle. That will be helpful. Then for your skin, as mentioned earlier, ultraviolet rays could overexposure could lead to development of a skin cancer. So using sunscreen with at least SPF 30, they need to wear protective clothing and then avoid tanning beds. Early detection is crucial, and regular screenings for conditions are important. Regular screenings, like if you have symptoms that are of concern, really concern to you, you should present to your doctor for proper history and examination. Okay, so I believe with these changes, with this kind of lifestyle, a number of people will be having a reduction in the risk of developing a cancer. Let me know your thoughts. 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 Oxalates in vegetables, junk. Yeah, okay. There are different types of vegetables. There are a whole lot of things that we may want to avoid eating, but we need to consider the value. Do we have greater value? Is it beneficial, more beneficial than uh, risky to take such? So we need to note that we may not have 100% of everything, so to say, but we need to check. Even consumption of water, heavy over consumption. Now, if you drink a lot of water, there's a tendency definitely to urinate more, and that can disturb your sleep. Okay, even though water is beneficial. So because you are urinating frequently does not mean that you have to stop taking water completely. It means you now need to reduce your consumption of water. On the average, an adult should take about 3 liters of water in 24 hours. Okay, so talking about these lifestyle changes, you need to just weigh the benefits. They should outweigh the risk, whatever you are engaging in. So I believe that there's more value in consumption of fruits, talking about apples, oranges, watermelon, uh, mentioned other types of fruits. We have papaya. We have different fruits that are available. Taking that compared to taking a lot of flour-based meals, talking about donuts, fries, a lot of sugars. Even you definitely sometimes can feel the difference in when you consume these different types of food. So the advantage should outweigh the risk or the disadvantage. So that helps you to make the right choice when it comes to what you choose to eat. And for emphasis, that sedentary lifestyle, we need to deal with it. You need to avoid it. A lot of people work remotely now. A lot of people get on social media. We are doing so much on our devices, phones, uh, laptops, desktops, iPads, a whole lot of things being done online, and this puts people at risk of becoming overweight, obese, and at risk of developing a cancer. So let's modify our habits, and this will go a long way. Okay, welcome back, Rajan. Yeah, it was a great time together the other time. I've made the first part as part one of this topic. I've made it available. It's on public. You can watch it. The initial aspect looked like I was just focusing and getting prepared to come up, but you can scroll a bit forward, and then you start to see how we really got engaged in the topic, talking about cancer, talking about the statistics, talking about the the risk factors and then the symptoms. Okay, welcome back. Okay, welcome back, Ranjit Rajan. Can't get rid of this dog. Wow. You can't get rid. Technology have improved. Okay. Yes, technology has improved. Okay. Okay. Thank you. Thank you so much. Thank you. Thank you all for joining in. If there are any, you can drop your comments in the chat box. But if there are any questions that you have, if there's a topic that you would like me to talk about, whether in a video, it could be a long form video, short form, or even on a live like this, then you can let me know in the chat box. Just drop the question. I will take note of that. Ranjit. Okay, Ranjit Raja says, when you see my smile, you're happy. Wow, thank you. Thank you for that comment. Now, it's good to smile, it's good to be happy. There are a whole lot of reasons why we shouldn't smile or be happy. Tension everywhere, stress everywhere, but we need to uh, be in charge and trust God to help us to overcome challenges all around us. Okay, thank you. Thank you so much. Thank you, Rajan. The guys should not drop bad comments. Okay, yes, KCL has actually been helpful uh, to help in moderating those comments too. Thank you. Thank you. Peace begins with a smile. Yes. Interestingly, we use more muscles to frown than what we need to smile. Okay. Okay, I want to request once again, maybe by the end of this session, we would have hit the 1,000 subscriber count. And as I mentioned earlier, I've been on YouTube for about 3 years uploading videos, and we are still counting. By the grace of God, I remain committed to providing you with adequate and well detailed information on how to stay healthy, how to improve on your health, how to keep fit, how to enjoy a good diet, and then attempt to respond to your questions. Okay. Maurice, you're welcome. Constipated. Why? Is this related to your diet? Do you need to make some adjustments to your diet? Do you need to uh, increase your consumption of water, vegetables, and fruits? Or you even need some medication? You may need to see your doctor for proper assessment. Okay, Rajan, you say you're always drinking. Okay, what drink? Water is a drink. When you say drinking, are you talking about alcohol? How to quit? So for any form of habit, there are actually different stages when it comes to uh, change. If you want to make a change to a habit that you don't like, there are different stages. The first thing is to uh, first of all, be contemplating. You have that habit, but you are at a stage of pre-contemplation where you are still thinking, I want to change. Do I really want to change? Am I ready to change? Am I ready to stop smoking? Am I ready to Am I ready to stop drinking? Okay, that's the stage. The next stage is contemplation. Okay, right at that time you are now thinking, maybe because of what doctor has said now, maybe because of this information that I have about the risk of being a smoker or drinking alcohol, then may need to change. Then also sedentary lifestyle. You may begin to contemplate on the need to engage in some more physical activities. Okay, so that's contemplation. And there's the uh, preparation stage. So by that time now you are taking a decision. You are preparing to start. Okay, so Rajan, I'm trying to address your question, and it may be helpful to some other people. You may now begin to prepare. That means, for example, if you want to get involved in exercising, there are some tools that you can have at home for exercise, like the stepper, like cycling or bicycle. There are some other equipment that you can use to engage in exercises at home. I did a video on even chair exercises that you can do at home, so you can check that out on my channel. Then working out, joining the gym, I mean membership of the gym. These are helpful steps to take. So that's part of preparation. I've talked about pre-contemplation, contemplation, preparation, and then the next step is action, where you are now deciding to take a step to change. Now, the aspect of taking steps to change may include you avoiding locations, avoiding friends, individuals who may actually put you at risk in that social life aspect, put you at risk of engaging in what you want to stop. For example, if your friends smoke a lot, if your friends drink a lot of alcohol, you have that tendency, even if you are saying you want to stop that habit, as long as you are with them, there's a tendency to still get involved. But there are people that have a strong will, and then over time they get to take their stand irrespective of their social environment. So that's a good one. Preparation. Action now. Action means that you are deciding to choose vegetables and fruits in the place of soda or carbonated drinks. So that's a healthy one. You are choosing to. Sorry, there was a network interference. Now you choose to sleep, get good quality and quantity. We have just 4 likes here. We have just 12 likes. Wow. I think we can have more. Kindly double tap on the kindly double tap on your screen to like this video session. Kindly double tap. Okay, Ranjit. Yes, I'm looking forward to that. I want to see your picture. Wheelchair, you say you have relations with a good girl, but have acquired bad symptoms. What's the problem? I don't know the symptoms you are talking about. and a whole lot of questions to ask about what you are talking about. Okay, thank you. So I'm going to actually create a time where I will answer uh, specific questions while on the live. So that will help. Okay, you say you work out in the gym, but at night you are still awake. Nobody can help you. I didn't get that, Trajan. Thanks, Doc. For one day you post your picture. What kind of doctor are you? Okay, I'm a medical doctor. I'm a family physician. Uh, into residency in family medicine. Okay, so that's what I do. Okay, so many of them want to ask, but they are shy or hidden. Okay, mean questions. Okay, please be free to ask questions. Then remember to subscribe. Remember to click on the like button. Okay. So in summary, we've looked at cancer. We've asked the question, why cancer? That's talking about how and why people develop cancer. We've also talked about the risk factors associated with cancers. We've talked about the symptoms of cancer. We've talked about the required steps for anyone with those some of those symptoms, and the importance of early diagnosis and treatment, appropriate treatment. The need for support has also been emphasized. Also, we talked about the preventive measures. Okay, so I've mentioned some preventive measures. We talked about exercising, talked about avoiding that sedentary lifestyle, talked about stop smoking, stop alcohol, know your family history, lose weight if you need to, if you are overweight or obese. These are some of the symptoms. Then if you have any form of infection or chronic medical disorder, then you should follow up on your management with your doctor so that you can have a reduction in the risk of developing any of these cancers. Thank you everyone for joining in. It's been an interesting time together. Okay, thank you, Rajan. You say, keep helping my dog from Nigeria. You have lots of natural medicine. What we call it? Body man. What's body it man? Lots of natural medicines. Okay. Thank you for your comments, Rajan. Thank you for your contributions. Thank you everyone for joining in. We'll be closing on this live soon. But if you are yet to subscribe, remember to subscribe and click on the notification bell so that you can get notified as soon as I come up live next time. I have a lot of requests on the need to come up more to give out this information, and I believe God is going to help us all, and then will help me to do more of this. So remember to check out videos on the channel. I've done a lot on hypertension, diabetes, exercising, mental health, and sleep. So you can check out those videos. Remember to comment, like, and share, and I'm sure I'll respond to you as much as possible. Okay, someone wants to say hello here. Hello, as John. Okay, thank you. So, thank you for joining in once again. Thank you so much. I appreciate you, everyone. Wow, thank you. Thank you. Thank you. Okay, natural doctor. You people call him Saint. What can I do for soft feet? Richard Jones sore feet, what's causing it? We need to find out what part of your feet and what could be the cause. Can we remove the cause first of all? And then you may need some pain relief. Interestingly, it's important to still have your doctor to examine this. When you say sore feet, what part do you have a wound? Do you have an ulcer on your feet, or it's just pain? So you need to be able to define this clearly, and then other. Do you have any medical condition that you are being managed for that may require managing, checking whether you are being well managed for. So these are areas to consider. But see your doctor for definitive care. Thank you, Rajan, for subscribing. I say I won't be alone. Thank you so much. Thank you so much. Okay, that means really you can share this channel, the link, the videos with family and friends. I'm sure they'll find this information helpful. Thank you. Thank you so much. When okay, Richard Joy say when you sit down or lay, it's like a reset of pain. Okay, but once I get moving, pain goes away. Okay, is this peripheral neuropathy? Is this restless leg syndrome? Okay, so there are a whole lot of differentials that can be around this. Wow. You say your family will be here tomorrow. Rajan, thank you so much. Thank you. Thank you. Okay, thank you. So what topics would you like me to talk about next? Kindly drop in the comments in the chat box. Let me see. There are a number of topics already, but as much as possible, we'll pick them as people like us to talk about. Okay. Thank you so much. Thank you. Thank you. Okay, let's increase the likes. Just double tap on your screen to like this channel, to like this video, so that the algorithm can help use to reach more people, so that this community can grow. Okay, Richard Jones, you're welcome. You're welcome. Okay, Rajan says there are 30 people here, so you can see the numbers. I'm sure a number of people more than that are watching. Okay, but some people come in and then they log out again. So, but kindly subscribe, kindly click on the notification, double tap on your screen, share with family and friends. I'm sure they will find my channel helpful. Uh, Beyond coming on YouTube, I also do online consultations. You can reach me on my via my email, drsoyemi@gmail.com. That's DOCTORSOYEMI @gmail.com. So if you want to have some personal interactions, consultations, then that will be helpful. Okay, so can we individualize your care, and we can get going on that. Then by God's grace, next week, exactly a week from now, I'll be marking my birthday anniversary. Okay, so I hope to come on live on that day, so you can join me. I'll be celebrating. Now I'll be thanking God, appreciating God, not necessarily having a party, but uh, just come on to celebrate with my community online. Okay, thank you, section 24. Say may God. Okay, Rajan. Okay, John is a boy. That's one of my boys. He's a boy. Okay, maybe the camera was presenting like a female. Is a prince. Thank you, Rajan. There is a Saturday here, and they are not in school, so we are in the house. So thank you for that. May God bless you. They always want to show. I did some videos that they showed up in some of the videos. There's a place I did something on granules, benefits of eating granuts, cooked granuts. Then you can check that video. Okay, I think they showed up there. One of them showed up there too. Okay, my children like to show up sometimes in my videos. Okay, so may God bless you, Dr. Soyemi, and your family. Amen. Thank you, section 24. Section 24, where are you joining from? Where is your location? Thank you for joining. Have you subscribed to my channel? Thank you, Richard Jones. Wow. Thank you. Thank you so much for subscribing. And thank you for the commitment to share with others. Yes. We need to show love to other people by introducing them to what we are also benefiting from. It's okay, Rajan. Yeah, it's okay. Thank you. Thank you. A wonderful boys there. Now, section 24, yeah, in California. Yeah, all the way from California. What time is it in California? Thank you. Thank you for joining in. What time is it in California? Rajan, thank you for the love. Okay, it's 4:06 a.m. in California. Thank you for the feedback. Interestingly, a number of subscribers are based in the US. From my analytics, I have been able to see that. So I found out that sometimes when I upload late at night or early in the morning, a number of people are able to watch and join in. So, and then people in India also, and of course, Nigerians, other African countries, and then other parts of the world, Germany, people from Poland, we had people from uh, different parts from Germany, different parts of the world. So thank you all for your commitment. Thank you for joining. Thank you for your encouragement. Okay, Rajan says, let's bless our dog. Okay, thank you so much, Rajan. Thank you. Thank you so much. Okay, we have 14 likes. We can add more before we close this session. Let's add more likes. Let's add more. Let's add more. More likes. More likes. More likes. Double tap on your screen. Is that simple? It's that simple. Just double tap on your screen and the like button will be highlighted. Thank you. Okay. Section 24, we've had a very robust discussion on cancer. Cancer is of public health importance, and we've talked a lot about the statistics, talked about the risk factors for developing a cancer. We talked about different causes and different types of cancer. We also talked about the symptoms and signs that may be seen in an individual with a cancer. We talked about the need for early diagnosis and then prompt management of patients with a cancer. And we finally talked about the prevention of cancers. I believe strongly that someone here has really been blessed with this information. So it's important for us to go beyond the information to taking action. I was talking about making changes. The final step in making a change, in making a change, taking a decision from the pre-contemplation stage to the contemplation stage to the preparation stage to the action stage. And when you are able to do this consistently for at least 6 months, the change that you have made, if you are able to be consistent with it for 6 months, then you will be in the maintenance stage. And that is where you can now soar, no limits. You have been able to deal with the negative habits, and then you are embracing the positive. So it may be related to stopping alcohol intake, stop tobacco smoking, stop or engaging even in more physical activities. Joseph Dubois, shout out to my buddy Nick Gard. It's his birthday. Okay, Nick Gard, shout out to you. Happy birthday. How are you celebrating? God bless you. Nick Gard, shout out from Joseph Dubois. Celebrating you today. Celebrating you today. Okay. So hope you enjoy your day. As I said, I'm also October 12, and it's going to be an interesting time together when I come on live. Okay, so love to God. Yes, I love God. Merjam Van Deren, love for God. Yes, it's important. Our spiritual health is another very vital and actually a foundational aspect of our overall health. So if you are very strong spiritually, you have a connection, a sense of connection, a relationship with God, then you are sure to have or to live a more healthy life. Now, I am a Christian, medical doctor. I have a relationship with God. I believe strongly in uh, divine healing, which is definitely real. So doctors do not deny the fact that there is the power of the divine, and there's room, yes, as part of management of cancer patients. There's a whole lot of involvement of uh, religious bodies, um, pastors, some people who are Muslims, imams, and people with their religious beliefs. They engage the support of their religious groups in their care. So this also goes a long way. Any ideas on how to deal with autoimmune issues? Now, autoimmune issues is like the body fighting itself. Okay, so it's important to be able to identify the type of autoimmune disease. Is it systemic lupus erythematosus? There are Is it reactive arthritis? There are many different conditions that manifest as autoimmune disease. So, but it's important to know that the factors that that cause a flare should be identified. Okay, lupus. Yes, systemic lupus erythematosus. So there's a tendency to have flares and could be triggered by some people certain food, some people stress. So you need to be able to identify the factors that cause a flare. Okay, yes, psoriasis and psoriatic arthritis. Okay, those are other types. Now, this diagnosis, once made, require multidisciplinary management, of course, involving majorly a rheumatologist, and then other supportive care will be received. So you need to identify triggers and be able to avoid triggers. You need to be able to uh, be adherent to your medications, not just those who have autoimmune issues, but those who have certain medical conditions that you have been placed on medications for, and this will be really beneficial for you. Okay, so I hope I've been able to address that briefly. Okay, so thank you all for joining in. I don't know if you still have any questions. Are there people just joining us? Remember to subscribe and click on the notification bell. I'll be closing on, taking a pause. If God permits, I may come up later in the day or in the evening or at night or tomorrow with another topic, and it will surely be interesting. But if you are here to watch, if you didn't join the first session, we had a very interesting part one of this discussion on cancer, talking about cancer. You can watch that video from the live session of the channel, And as soon as possible, I will also make this particular session available so that you can follow up on it, and you should also share with others. Thank you everyone for joining in. I appreciate you all. I appreciate you. I celebrate you. Kesel, Rajan, section 24, Richard Jones, what is that again? Okay, nigga, I can see you there. Dustin K, Wiltre, Morris. Okay, you say you are constipated. So, talking about this constipation, you need to drink a lot of water, increase your consumption of fruits and vegetables, reduce your consumption of starchy and high sugars. Then you should see your doctor for proper evaluation. Chris K, what do you mean by grow your meat? Morris, okay, I've responded to that. Okay, Z drama beats, kidney health. This is well noted. Okay, I'll be talking about kidney health in subsequent sessions. Louisa, Lilimo, Kesel, Rajesh Spicy, Aaron J, Franca Raphael, thank you for joining in. Mountain Man, Louisa, Cook with Sandy, Clara Ridgway, Anastasia Umro, Greta, George Floyd. Now, these are people that actually drop comments. There are many others that joined in but didn't drop a comment. But if you are here to double tap on your screen, remember to double tap to like. Alicia Benefield Williams, thank you for engaging. Thank you for coming in. Thank you for your comments. Candy Henry, MK's Arena, Laser Beam. I live in Nigeria, I've mentioned that. Grease for the H. Ude Setia. Sifting. The Panda. Talker Key Backpack. Repentant Remnant. Adam Taj. England. Yuli Anona. Yes, I'm Nigerian. Depressed Soul. Ifeoluwa Oke. Rewrite. Keza 69. Ian. Thanks for joining. Carib these shots. Jericho 10,000. Josh. Wow. So thank you all for joining in this session. So I'll see you in my next video, a live session. Bye for now. I celebrate you all. Bye, bye, bye. Remember to watch and drop your comments, questions as I made the video public. Bye for now. Bye. Yeah.